Right. Okay, we're getting recorded. Lovely. Okay, what I'm going to do is I'm going to put some resources to about delegated healthcare in the chat box. But if you lose them at any point and want me to resend them, just drop me an email. Oh, someone else is joining. Right, wonderful. Okay, as I was saying, the session will be recorded and I'm going to add some resource links in the chat box and my email. If you have any questions after the event, please feel free to email me and I will try my best to answer it or signpost you somewhere that will answer it. Right. Zoom's being annoying and saying I can't share that many links at once. Right. How about I'm going to send everyone the links to the resources because Zoom is being funny with its word count. Just so we don't waste any time as we want to tight schedule. Okie dokie. So just to share with everyone, our agenda today, we were just waiting for everyone to join, obviously. After that, I will discuss the what is delegated healthcare and what that means sort of in layman's terms, because I know a lot of people do have delegated healthcare in their care routine, but they don't realize it is. So we were going to briefly talk about that. Then I will share my experience with delegated healthcare. After that, we will have Rachel from Skills for Care and David and Leona from Mark Bates. Then we'll be opening up to a Q&A and then we'll do the final wrap up. And remember, feel free to email me if you forget anything, have any questions that Zoom will let me put in the chat. So we're all right there. Yep, so just drop me an email. Wonderful. Okie dokie. So I'm going to get cracking. Okay. So what is delegated healthcare? The official description of delegated healthcare on Skills for Care's website is delegated healthcare. A delegated healthcare activity is one that a regulated healthcare professional, such as a nurse, nursing associate, occupational therapist, or speech and language therapist, delegates to a care worker or personal assistant. Now, in more simpler terms, because that is a bit wordy, it's delegated healthcare is an activity when your PA performs a task traditionally completed by a medical professional, such as nurses, doctors, and other medical professionals. So that essentially is what delegated healthcare is. It's when your PAs are trained and learn and take care of a task that once was dealt with by someone from the medical background. So that's where we're at. Some examples of this are ventilation, NIVs, full of ventilations, the whole lot, cough assists, oral suctioning, catheter care, TPN use, tracheostomy, dressings and wound care, bowel care, peg feeding tube changing, and peg feeding care, and just using it in general, PICC lines and stomas, including ileostomies, colostomies, urostomies, and all the other stomies that we have. So that's just a brief list, and that's not everything. You know, there are far more things than that. But if I spent the entire time reading the list that Mark Bates gave me when I was talking to them about my insurance, we'd spend the whole hour listening to that. So yes, that is what delegated healthcare is. Now then, for me, the one thing to remember is, before I go into how I've used delegated healthcare, is every single person is different. Every person's funding body is different. Every person's medical team is different. Every person's medical needs are different. Therefore, what I'm about to tell you is not a gospel. This is how delegated healthcare is incorporated into your care routine. This is merely my experience and one of many, many, many examples of how delegated healthcare can improve your quality of life and allow you to live a more fulfilling life. There will be a video coming out from Skills for Care, and as soon as that is available, I will send everyone the link, because a group of us with delegated healthcare shared our experiences. And in that video, you'll also see more examples of things that PAs can be taught to do. So I always want to stress that first, that I've attended an event where I shared my story, and someone wrote to me and said, well, I've just told my district nurse, and she said, well, that's not what we're doing. And I had to explain, I know that's how it went for me, but it might not for you. But hey, and also, not all of my medical tasks are actually trained and performed by my PAs. There are a few that my doctor seems to be a bit reluctant to allow them to do. So again, just because you have some of your medical needs met by your PAs through delegated healthcare doesn't mean they have to do all of them or they will do all of them. It just depends on what your environment chooses, your funders, your medical team, your PAs and yourself. Because that's another thing to remember. If a PA isn't comfortable performing a delegated healthcare activity, it's not really the best thing to force them into it, because you want them to be confident with it, so that your needs are being met and there's not going to be no accidents or no mistakes made. So that's something else that's very important. So I've been using delegated healthcare for the last 12 years. However, I didn't know it was delegated healthcare until 3 years ago. We just thought that's what my girls need to do for me, and that's how it goes, and that's that. So we weren't actually aware that there's a whole world that explains this part of your care, that there's a whole thing about delegated healthcare. So I found it really, I was a bit confused to start with, and I've heard that from quite a few employers. They have been rather confused as to what it means, how it works, and how do you get it? Or do you have to have it? Because that's the other thing. If you don't want your PA to perform a certain task, you don't have to either. You can also say, actually, no, I like my nurse doing that. I don't feel comfortable. And that's something else. Delegated healthcare should be something that's involved in your care that you're happy with, your PAs are happy with, your medical team and your funders. It needs to be a group decision. Apologies for the doorbell. It needs to be a group decision and not one that someone wants but not everybody is happy with. So that's something else to think about as well when we talk about delegated healthcare. So some of the delegated healthcare tasks I personally have met are my PEG, feeding tube, my chest respiratory care, my NIV, my stomas, wound care, and also my PAs give me controlled medication. And my GP did say to me that actually that is also a delegated healthcare activity if your PAs are giving you, a controlled drug, because usually, as we all know, if you're in a hospital or if you have an agency, they would require two people to sign that off when it's a really strong and serious drug. So that too is also a delegated healthcare activity, and one that my PAs also take care of for me. So initially, the way my team do it, I approached my team when I've been having PAs for 14 years. So 2 years in was when I started needing more, what you might class more medical tasks. And it just automatically became part of my routine, and the PAs were doing it. But it wasn't until a little while into that I realised there needed to be a bit more structure, and that's when me and my closest medical team were like, right, we need to have a bit more organisation. So now the way it stands is, if I have a new task added to my my routine, all of my PAs are trained then by the nurse or the doctor or whoever's involved in assigning me that. If I have a surgery that means my care might change, anything like that, then my medical team would train that current staff. Once those staff have been trained, they are then allowed to sign off, as well as myself and my mum, if they've been signed off as seniors. So not all of my girls, my team have. I have two girls that I've had the longest. Them, along with myself and my mum, have been signed off that any new members of staff we can train in-house. And then I am reviewed by my medical team every 6 to 12 months. And also my medical team are at the end of a phone, and we can contact them at any point. If any PAs that join the team that need the in-house training isn't enough and they need more from the medical team, then the medical team will come in and do that. Either I'll go up to the hospital and do it, or they'll come to the house, depending on who it is. So for me, we have a bit of a combination of direct medical training. And so me and my mum and my two senior PAs, we went on to a course with all my nurses and doctors, and we had to do, it was a whole day thing. And we done this course, and at the end of it, they agreed, yes, we're competent, we know the full training, we're able to do exactly what the nurse does in signing off PAs. So when we passed that training, we then were told that when a new thing comes in that none of us know about, then obviously the medical team deal with. For example, I'm changing PEG providers. So that means the nurses from that company will come out and train us all on the new equipment. So anything new that comes in that none of us know about, of course, that's dealt with by my medical team directly straight away. But anything that I've been doing for years that I know inside out, my seniors know inside out, and so does my mum, that then is agreed that they can sign off new staff. However, as I say, I do have a 6 monthly and a 12 monthly, not yearly, review, where my medical team will come out and they will watch all of my staff doing it, and they will make sure that everything's okay. They also make sure that my care is correct. They make sure that not only what they're doing is right, but that my general health for that is right. For example, the stoma nurses, they'll have me in and they'll check my stomas properly. They'll watch the girls train, changing them and caring for them. And they then sign off that, yes, Charlie's in full health, and the team are A-OK for doing it still. And then we carry on. So then we get new staff come onto the team, and the seniors, the assessors, we sign them off, and then we get our reviews with the medical team, and we get, for anything new, we get further training on, just so ultimately, because my doctors feel that because I have full capacity and I'm able to explain myself very well, that they feel comfortable that if I'm confident in a task, or my senior PAs or my mum is, then at the end of the day, as my doctor puts it, it saves the NHS. So that is something that they do. Now, with that is the basics of how mine works. We have the initial new training for anything new in my life. for example, when we swapped ventilators to a new one, full training was given that by the techs at the hospital. That wasn't something, so I would never train, we never train PAs in-house to do a new medical task. They have to be, we the assessors is what we got labelled, me, my two senior PAs and my mum, we all have to be signed off again to be that assessor for that task. And that's how we do it. And I know that might sound rather odd to a lot of people, and it might sound like, well, hang on a minute, surely you'd have a bit more. But it actually works very well. And in 12 years, I've never had a new task added or anything go wrong using this system. Now, this system is ours. And as I say, I also have countless written instructions for how to do everything. And we have training videos that we made. So my staff have full written instruction, video instruction, and physical training instruction to do those tasks. So it's a combination of all of that is what we use, and my medical team are happy with that. And like I say, any task they're not happy with my team doing, they don't, and they still don't do certain things. And it's frustrating for me, but you've got to deal with it because that is rules. So that is a really brief thing of how I do everything. And we really actually enjoy the system that we use because it gives my PAs, they say they feel really confident. I trust them to do such important tasks, and they like the fact that they're given the experience and the opportunity to do medical tasks and to care for me in certain ways that perhaps they would expect a nurse to do. So I'm very lucky in that regard that it works out well for me. But I know a lot of other people have very different governing systems, and that is, part of delegated healthcare is checking everything's going right and governance. So ours works well. As I say, we've been doing this for years now, and all my medical team have been happy with it. And also another thing highlighted that me and my medical team discussed is a lot of the time, if these girls got sent away somewhere for training, that just wouldn't be relevant to my situation, my needs. And, like if they went on generic PEG training, that is just a generic PEG training that they go on in an office. That doesn't actually mean it's how my PEG's used. That doesn't mean that they're the devices, they're the accessories to the PEG that my PEG uses. So we find a combination of training under the medical team and in-house, a good combination, because my girls, we know they're safe, and also we know they're trained to me. So yeah, I know a lot of people have gone to their medical team and asked for something, and like I say, every team are going to be different in what they want. Every person's different. Also, the medical task in question is different. So I always stress is talk to your team, find out from your team what they need, find out from your funding body, your medical team and your PAs, what do they need to feel comfortable with doing this, and can we make it happen? And sometimes you can, and that's really, really great. And other times you have to, work with each other a bit in order for that to become a safe and sustainable option for everybody involved. But yes, that is my little blurb. I know I rushed through that, didn't I? But I'm very cautious that I don't want to take up everyone's time. So what I'm going to do is, does anyone have any quick questions for anything I've just said? First of all, feel free to say it or pop it in the chat box. I don't mind either way. Okay, that's fine. If anyone thinks of any, don't worry. I'll ask you again at the Q&A. So I am now moving over to our guest speakers. Rachel Yates Hoyles is from Skills for Care, and Skills for Care have done an awful lot of work in delegated healthcare. And Rachel is going to talk about delegated healthcare from their point of view and some of the things that they've come across.
Thanks, Charlie. Yeah, I've not come prepared with anything because I didn't know what I was saying, but
That's okay.
and I know
Yeah,
you've been involved with a lot of this work, but I'll just speak from what I know. Hello everybody, I'm Rachel Yates Hoyles. I work for Skills for Care, and I've been involved in delegated healthcare for the last about 18 months on this work stream. I also work on another work stream around individual employees, personal assistance. So both of these work cross over quite a lot. And I've been lucky enough to work with Charlie on both of these things, haven't we? And they've crossed over and we've tried to merge the two together a little bit. So that's been helpful. But I think, Charlie, you've given a really good description of what delegated healthcare is. It is a complex area, and the language that people use around it can be confusing as well. So we talk about tasks, we talk about interventions, we talk about activities, and it is complex, isn't it? At Skills for Care, we prefer to use the word delegated healthcare activities, and we try and refrain from using tasks or interventions just because they're as tasks. We try and get away from task orientated things as like a to-do list. People are not to-do lists, they are people, and the things they're doing are activities. You've said it before, we don't have a list. There isn't a national list of what a delegated healthcare activity is. Um, a lot of people have asked for one over the years, just to give them some guidance, but we can only give examples of what delegated healthcare activities are at the moment, just because we feel that if there is a descriptive list, then it takes away from the person-centered element of it. Somebody might come along and think, is this a delegated healthcare? Oh, it's not on the list. So we don't want to like give out a list if it's going to stop somebody from having a delegated healthcare activity. So the key points are, which I think you've raised, Charlie, is one, delegated healthcare activity is voluntary, which is very important to know that because I think some care workers and PAs can feel pressurized into feeling that they have to do things. A nurse has told me this, oh goodness, I've got to do it. And they might not feel confident or they might have the training but still not feel right. So it is voluntary and they can, don't have to do it. So that's one thing to mention. I think Sam's put a link to the web page in the chat there. I was going to do that, but there's so much stuff on there. Honestly, it is hard and you can get lost in there. But there's some really good resources in there. Charlie's mentioned some videos and things in there, and there's some really good case studies to help people understand really about what dedicated healthcare is. Um, Going back to May 23. So delegated healthcare has been happening for years. It wasn't even called that, I don't think. It was just something that people did. Um, but in 2023, in May, this framework was had started to help and support people understand it more, because there's a lot of challenges around it. And there were four principles that were developed. So you'll see them on the web page as well. And from that, nine test sites were created throughout the UK to try and test out in practice what these actually meant. And then we've had an independent testing and evaluation done by a research company called York Consulting. They've gathered all the information, and their reports are on the web page there that's in the chat. So you can have a look at those if you wish. They were also reviewed and published in November 24, just a few months ago there. So they have been reviewed and up to date information there. But essentially, it's key messages around it's got to be right for the person. It's got to be right for the person. It's got to be in their best interest. And they've got to have the right training and support going forward. That's a key message, really. In simple terms, there's lots of challenges around commissioning, governance, training, insurance. I know Leona, you was on the learning exchange yesterday, and that was one of the key questions that come up. It comes up every time around that. Something called TDDI that comes up. The key themes keep coming up all the time. But hopefully, local systems can start working together to make it more simpler for people. Hope that's enough, Charlie.
Yes, no, that was wonderful. Thank you so much. Sorry, I wasn't ignoring you. I'm just reading the
Oh,
chat to make sure that I'm not missing anything important anyone's asking from us. Wonderful. Okay, I will pass over now to David and Leona, but thank you very much for that, Rachel.
Hi everybody. Hi everybody. Yeah, we hear you. You did a great overview there, Charlie. That was fantastic of your journey with personal health budgets and delegated healthcare tasks. We understand it can be really difficult. So we're coming from myself and my colleague David. If you can give us a wave, David. We're coming from an insurance perspective. We're Mark Bates Ltd, and we've been involved with Skills for Care with NHS England to develop a policy specifically for delegated healthcare tasks. So typically when you're an employer of a PA, you would have your employer's liability certificate in place, wouldn't you? And there is, and you might want to check which level of cover that you do have, because if it is that your PAs are performing delegated healthcare activities, then potentially you might like to upgrade the policy to what we would call the deluxe policy with healthcare. So that not only covers the employer for any instances, but actually it covers for if the PA was to injure the person that they're caring for. It's not a legal requirement. You don't have to have that higher level of cover, but it might pique your interest to know that it's available if you should want that extra level of protection in place. Like I said, we built that policy alongside NHS England, and we work closely with Skills for Care and other organisations within the independent living sort of sector space, healthcare and social care space, to ensure everything that we're doing on our end is it suits your needs. So the policy itself, there's three things I suppose are important to remember when we're thinking about the insurance. And Charlie, you put it so well. The training aspect is vital. Part of the delegation process would be that the PAs are trained by medical healthcare professionals. So that's what the insurers are looking for as well. So you're quite right in doing that process that you have there is fantastic. So an insurance dream, well done. Tick, and hats off to you. Medical healthcare professional and the training provided. Now, you didn't mention, unless I missed it, and I'm hoping you're going to give me the green light here, Charlie. The evidence, do you collate evidence of the training? Do you have some form of written evidence in your documents somewhere?
I do indeed, I do. Everything's recorded to the point that I slightly look like a psycho.
Yeah, okay. No, that's perfect. That's what we like to hear. So yeah, those three things are the most important when we talk about the insurance. So once you've got those three things, so your PA's been delegated officially that healthcare task. They've trained up by a medical healthcare professional. We need some form of evidence. So that doesn't necessarily need to be a certificate or a degree or anything like that. It's just some form of written evidence. So it might be a note from your doctor to say, we're quite happy that PA in the name is competent. You mentioned that word earlier, competent to undertake this task. We've delegated it over to them on this date. So some form, whether it's an email chain, whether it's a note on your care plan from the registered nurse, some form of written evidence that you can produce if there was ever to be a claim. We don't ask for it upon setup of the policy. You'll be relieved to know, but if there was something to go wrong and the claims team were looking into, was the PA suitably trained, that's where it would come in. So that's worth remembering when we're talking about it from an insurance perspective. And Rachel, you mentioned about not being a list. There's not an official list, and that's, you're quite right in saying that. And it's interesting because over the years we've added on to what we deem necessary, what we accept as a delegated healthcare task. So if you're not sure, if you are confused as if it would ever be official, insured or anything like that, you can give our team a call. They're super helpful, and they can see if it's not on our already agreed upon delegated healthcare activity, then you can ask, and we can refer it over to our underwriters, and they can let us know if it can be added on to your own specific policy in that sense. Call it an endorsement. An endorsement could be added on to have that particular task added on there. So I hope that helps. I'm sure there's lots of questions when we talk about the insurance side of things. So happy to answer any questions if there is any.
If you would like, I can always, if anyone comes up with any questions after the session, I know sometimes it could be a bit daunting to ask it in a group setting. I will send them over to Leona, and if she has time, maybe she will answer those for us.
Absolutely.
Wonderful. Oh, we've got a message. Interesting. So with that, sorry, I nearly said your name then, sorry. The thing is with delegated healthcare, although the ICB are being very helpful there, I don't know fully if that's something you can get around, or if it's kind of like just their hard decision. Because that's the other thing. Sometimes the agreement on delegated healthcare doesn't always mean it'll always be there. Sometimes your medical team or your care team can make changes. I know I have a delegated healthcare activity that used to be performed by my PAs, and then my care manager changed along with one of my doctors, and now they're like, oh no. So I know someone I can ask about that, so I'm going to send that question. Okay, thank you. I can send that question over because I'm not fully sure on exactly what to advise. All I can say is I have experienced when a delegated healthcare activity was once agreed and then they basically took it back because the team changed. I'm not saying that's going to happen to everyone, don't get me wrong. I'm just saying in my personal case, I've got a busybody and it got changed. But I'll look into that for you and try and get an answer on that. Does anybody else have an answer? Oh, Rachel's got a hand up. Yes, Rachel.
It might be worth just going back, asking the ICB why.
Yeah. Ask them why.
What's the reason? Try and understand it a little bit more. Are they the main commissioner of the care package?
Because it could be that if you find out why, you can find, yes, they are. If you find out why, then it means you can then try and figure out what the go around is. Because that's always what I do. And I do with one of the tasks of mine that got taken off, we are constantly finding ways around until it gets signed off again. So absolutely, if ever your funders or medical team turn around and say no or change the goalposts, ask why, and then see if there's a way around it. See if there's a safe, way around it. Obviously, don't cut corners where people can get injured.
I think it's important as well to build a relationship up with your commissioner as well, isn't it?
Yes.
Because things are always changing.
Yeah.
So it's good to always keep that line of communication open wherever possible. So that's an opportunity to do that.
Yeah. One thing I will always say is I had a particular, we're going to call them a particular PA. I had a particular PA, and they were performing a task, and then that task was only assigned to the one person. They were the one person that got trained by that medical professional, so they were the one that done it. And I was like, well, okay, that's not really that convenient, because if she's on a day off, what do I do then? But anywho, I was given her, that's what they agreed, and we found out exactly why. And the reason was they were concerned with the legal aspect. So I went to Mark Bates, and I'm allowed to say I'm a Mark Bates girl in this. Normally I'm not. So there we go. Normally I have to stay professional and say there are multiple organisations you can go with. we found the go around, and the issue was they were concerned that my insurance weren't able to cover it. So if something went wrong, they didn't want it to come back on the medical professional, and that's why they took the task back. So I then went to Mark Bates and explained the situation, and they said, no, if the medical team's fine, it won't get, they obviously they said that in a lot more illegal and official jargon than I've just said. But basically, we all figured it out and we found a way, and that was fine. So I then approached the medical professional and said, look, we've gone to the insurance, they're still happy. They know the PA's been doing it for years. So, everyone's happy. So if you're happy, we can go on. There's been no incidents of any harm or anything going wrong with the task. And eventually, after a while and some back and forth, we found a way around it. So fingers crossed. It's all about asking the question, well, why? I think sometimes they might want us just to give up when they say, no, we're not doing that. And they just, I don't know about all of you, but my medical team, some of them aren't very they don't like the fact that they've now got to train my PAs. It's a nuisance to some of them. So it's really, really important to not just go, if they say no, go, okay, ask why. Always ask why, because there may very well be a go around. Sam's put, I'm in Wales and understand that there are differences as we can't receive PHBs at the moment. I'm funded 50-50. I don't. Question. I have a review next month. I will discuss it with them. Yes, absolutely discuss it with them. Ask the why, and then sit down and see, is there a way around that why? And just make sure that as long as everyone's trained, everything's safe, everyone's covered, then delegated healthcare could be a great thing. Is what I want to add. It can really open your life. I mean, the video that I was part of with Skills for Care, I was having a tattoo whilst having my feed and my meds at the tattoo shop. So that there sums up what delegated healthcare is to me. So what I'm going to do now is I'm going to open the floor to questions. If anybody has them, for me, for Rachel, for Leona or David.
I would just like to add as well, with the insurance, there is no excess, which is unheard of when it comes to insurance across the whole of the board.
Yeah.
With car insurance, you have to pay an excess if there's a claim. Home insurance, you've got to pay an excess if there's a claim. However, when there's a claim with Mark Bates insurance, there is no excess to pay whatsoever, and it remains the same premium fee rolling year afterwards, I'm pleased to say. So, we want to make sure that people do feel comfortable that if they are eligible for a claim, that they can do so.
Yes. I love the team. I've a little bit too much got them on speed dial at this point. I feel like they may have been seeing my email. Oh, sorry. I am the person that will go, right, so she's just shouted at me. What do I do? No, I don't ask them those questions, but you know what I mean.
We want you to contact us for the small stuff. Yeah,
absolutely.
Before it escalates into a bigger situation. It's really reassuring actually to know that you reach out to us and we will answer the phone within seconds. You try and contact a organisation nowadays and it's sort of, it puts you off, doesn't it? And you think, I'm going to be stuck on hold. They're not going to know what I'm talking about. No, our team they're really quick on the phones and they're a super friendly bunch. So yeah, always ask away many questions.
Rachel.
Thanks, Charlie. I'm just being nosy about the insurance because I'm trying to understand a little bit more, so hopefully you can help. But I'm just understanding this. So if somebody wants insurance, does that become part of their care plan, and does that get commissioned? So whoever is paying for it, is the insurance included within there, or are people paying for the insurance themselves?
Yeah, typically it's through the budgets. It would usually
get allocated that through the budgets, right?
Yeah, absolutely. Most of the time, we work really closely with all the ICBs across England, and in fact, even Welsh government at the moment, because they're looking into it also. And there's always so many sort of complex questions that they're trying to unpick. So yeah, it's typically within budgets as we understand it. Yeah.
Good. Because I was just thinking, obviously you mentioned like the upper level sort of insurance that people go to, just to make sure that is covered within people's budgets. I didn't know if people topped it up themselves or, I didn't know.
Yeah, most
No.
ICBs, there's none that I'm aware of that wouldn't include it within a budget.
Good.
Some ICBs would prefer the minimum level of cover, just your basic employer's liability cover and not the healthcare cover. There's not many of those about. I think the last time I heard of that was a couple of months ago, but they're keen to upgrade, get everybody's upgraded. Once we had a conversation, didn't we, David?
There's one there's one in particular I had a meeting with not too long ago, but said that they're looking to upgrade it as soon as possible to mitigate that risk, because ultimately it's a small extra amount, but actually it could mean that a lot of payout is taking place in case the worst happens, which is what it's all about.
Extra protection.
I unfortunately am the person that has to top mine up. So my funding body won't pay for the delegated healthcare cover. And unless I top it up, they're pushing me, and I mean pushing me, to join another provider who apparently has promised them that they'll do delegated healthcare under their normal rate. So although it is in my budget, and although it's a legal requirement for my funders to provide all the legal requirements I have to be an employer, mine are only paying for the the deluxe standard and not the delegated healthcare. I have to pay that now, because otherwise I don't get it.
That's tricky, isn't it? There's definitely other providers out there that are a lot more lax. Perhaps you don't have to train your PAs and such, but from working with NHS England, the delegation process, it's very clear that the training must be in place and such. So it's really important to do a little bit of research on what policy you've got. Which ICB is that, or don't you want to name and shame? I shouldn't ask, really, should I? But it's interesting. Yeah, it's interesting. I'm sorry that you have to pay for it yourself.
It's I'm under social care myself, so it's my LA that won't, my local authority.
Yeah. Okay. Yeah.
They want me to move, and I said I'm not moving.
It's sad, isn't it? Because it becomes a postcode lottery then, doesn't it? That some local authorities or ICBs are paying and some aren't. It's sad.
They said, I actually got an email from my local authority that said if I pushed them any harder on this, they would remove their agreement on me having delegated healthcare.
So it's a shame, really, because I suppose in some ways the council who are pushing that onto you may not realise that there's actually parts of that insurance policy that we offer within the policy in itself. So they're probably looking at it on the face of it, thinking, okay, well, this is great, but actually, when you scratch away at the surface, there's a lot more benefits in there that aren't in their policy than it is in ours. So it's just wary of that, and it's a little bit concerning that they're trying to push that on you, really, because it's about choice and control, isn't it? Ultimately, you're entitled to make your own choices of who you wish to be insured by, and it's raising a few alarm bells. So,
no, they're not. So, but hey ho, I pay it now, so we're all good. I like having it. It makes me feel, for me personally, it's a real, as the employer in the delegated healthcare chain, as it were, it makes me feel much better knowing that I'm covered from all angles. My medical team are happy. My PAs are. My funders never will be. And I have the right insurance. So it just covers everything. And I do highly recommend that if you are lucky and your funders will pay for the extra, make them pay.
Good for you, Charlie.
I don't know if I'm going to get shot saying that, but hey ho, I've said it now.
I'm happy to answer the question in the chat that Sam's put in, if that's helpful.
Yes, please.
So, from somebody who's unable to attend, they've mentioned there is a big need for access to training in Wales. However, they cannot use Skills for Care, and my funders have no help in securing training for me or my PAs. Is there another organisation that can help me? Essentially, it's the healthcare professional, the nurse, whoever is delegating the activity. So essentially the nurse, the OT, the physio, whoever it is, they are ultimately responsible for providing the training. So one of the challenges that we do here within our work is that it's difficult sometimes to engage with healthcare professionals. The access to nurses is sometimes difficult, but it is within the NMC code that it is part of their registration that they do provide training for that person.
The thing is,
Although training providers do it, it is their responsibility.
the only thing question I'd have on that is, obviously with a fund like Skills for Cares, i.e. for individual employer fund or user-led organisation fund, obviously that's quite a broad, there's a broad amount of training and topics that you could cover using that fund. But if you're going to your funders, your ICB, your care coordinators, and asking them to do it, they're only, if they will pay, some people are finding that they won't actually pay for the same types of training. They'll only pay for the ones they deem mandatory, aka want to pay for. So it's a real shame that there isn't something available so that training could be more accessible in the formats that we need. Sometimes the mandatory training they're suggesting doesn't always include everything that is relevant to our care. And I think that there's the problem, isn't it? Is getting them to agree to be flexible.
Yeah. I've put a link in there because I think you're referring to the individual employer funding. Yeah. So that's accessible for any IEs or PAs who want some training. Where delegated healthcare comes into this is we've got to be careful because sometimes there's double funding.
Yeah.
So we've got to be careful around that. But I've put the link in the chat for anybody who might want to access that fund.
Leona, you have your hand raised?
Hello. Yes, training that's not coming from the nurse or the doctor or the healthcare professional. You can get outside trainers, and if you really are struggling, our team are quite equipped with any sort of outsourced providers that might be able to help. So we could point your ICB or your local authority in the direction of that organisation. Maybe, I mean, just for in Wales, for example, Swansea Council asked if we would accept St John's Ambulance to train their PA in EpiPen training, and that was agreed. So if we can try and be creative, it's always worth asking the question. Don't always assume. Just pick up the phone and have a conversation, because there might be that answer out there.
Yeah. I think another question that I come across is a lot of the time, people have employers have been sharing with me that their PAs have been sent off for the day to do the training so they can perform the delegated healthcare task. And it turns out they sat in a room at a computer and done an online course. And then they go around their house to do said task. And they're like, I'm really sorry, but this isn't what it was like on the computer. And I think that for sure I think that it definitely needs to be looked at the most appropriate training for the task. Sometimes people think, well, they've done a training, but it's like, no, it needs to be the appropriate one.
Yeah, e-learning, sadly, the insurers wouldn't like that. No, sadly not. No, it would have to be, medical healthcare professional for sure, face-to-face. It can technically be virtual because of course lockdown came around, didn't it? And just stopped to a lot of face-to-face. So if it has to be a virtual session with the medical healthcare professional, that would suffice. We'd prefer, obviously, of course, face-to-face training, but if it has to be a virtual session, then that's because it could be a long distance for the PA to travel to get that training. It's been agreed, I think, since lockdown that's acceptable. But as long as it's not a quick half an hour e-learning course on something that's not sadly accepted.
Does anybody have any other questions? I was going to ask, is there any resources that Mark Bates could provide us? For example, Skills for Care on their website has a vast range of resources regarding delegated healthcare. Is there anything from a Mark Bates point of view that I could email out to the attendees and some of the people that couldn't make it? Is there anything like that?
Yeah, absolutely. I can send some over to you.
That would be wonderful.
No
Thank
problem at all.
you.
Absolutely. Yeah, for sure.
Yeah. And again, tonight's session has been recorded, I hope. So those that couldn't attend today can come back. But today's event was mainly an opportunity to start the conversation, to learn what it meant. Today wasn't the day to find out everything under the sun. And I think we've done well in starting that conversation and giving a good real life experience of what delegated healthcare means, because it's very wordy and it can be a bit off-putting, but actually, you know, you'll find that most of the time they're things your PAs were doing anyway. Like I didn't like wound care. I'm like, well, I didn't really, you don't really, it's interesting to learn what the things are under delegated healthcare, because some of them you're like, really? Like hooking my feet up. And I'm like, that's just part of nutrition, is it not? So I find it really interesting to learn all the new things and to hear from other people. So if you have any questions or you'd like to have another session discussing delegated healthcare a bit more, please do let us know.